So this week's evidence-based update is looking at a publication that looked at geriatric and senior health screening in dogs, and this was specifically in a group of healthy dogs. There's been numerous recommendations for senior and geriatric care programs, and in general, these programs recommend a history, a physical exam, and systolic blood pressure and laboratory testing. However, there's little scientific information regarding the abnormalities in senior and geriatric dogs. The objective of this study was to prospectively evaluate senior and geriatric dogs that appeared healthy to their owners and to report the presence of the abnormalities that were detected. The question then becomes whether this detection leads to improved quality of life or longevity. And at this point, this is unproven. There's no evidence for that. Although in this study, the authors did find several abnormalities. So in this study, they did make a diagnosis of cutaneous mast cell tumor in 2 dogs. There was a mammary nodule in 1 dog and chronic kidney disease in 1 dog and hypothyroidism in 1 dog. So a smattering of various diseases. So if these numbers are true, 1% of dogs might be hypothyroid, 1% might have chronic kidney disease. But if your geriatric dog has one of these problems, that's important. And so we might say, well, it's not super common that these dogs have chronic kidney disease, but it is common that they have at least one abnormality that might need to be addressed. And other things that were found, there was many abnormalities that were found, including dental disease, orthopedic problems, obesity, as well as laboratory abnormalities. And although they might not have been addressed right then, they did warrant further follow-up with their veterinarians. I think that this study does validate the current recommendations for annual senior and geriatric screening because our dogs do age much faster than we do. And by taking them in on a regular basis, a lot of these things that are subtle, for example, changes in urination or drinking, subtle changes in physical activity, and weight. One of these dogs was diagnosed as hypothyroid, and certainly that is a condition that can lead to obesity, which then can lead to orthopedic problems and many other problems. So all those things are important to discover early so that we can try to intervene and improve our pet's quality of life. And that's this week's evidence-based update.